Good morning to everyone, to Ariel who joins us today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today is a very special day for Cuban and international public health. It is the 15th anniversary of the founding of the Henry Reeve International Medical Brigade, specializing in disaster situations and serious epidemics, which, as you know, was founded in 2005 by Comandante en Jefe Fidel Castro to assist the people of the United States who had been affected by Hurricane Katrina. This is how the brigade began, which, I repeat, was founded by the Comandante, and is a beautiful act that we celebrate every September 19th. Over the last 15 years, our healthcare professionals have offered their solidarity in many countries, in dangerous situations, in disaster situations. Remember the work of the brigade in Pakistan following a massive earthquake, working in field hospitals in difficult conditions. They have participated in different actions in Africa. Remember how they helped fight Ebola when over 250 Cuban collaborators were working to control the outbreak of this highly contagious and lethal virus. Most recently, the heroic health professionals that make up the Henry Reeve Brigade have been called on to help combat the coronavirus pandemic in 39 missions in 39 countries. Often, these medical professionals return life and health to populations that have been affected by such situations. We therefore offer our congratulations to the brigade and recognition of all the work they have done and continue to do. Once again, congratulations to the Henry Reeve International Medical Brigade. We start today's press conference with the unfortunate news of the death of 2 people with COVID-19 yesterday. The first was an 80-year-old man from Ciego de Ávila, who was suffering from some pre-existing medical conditions. He began to develop symptoms on September the 6th and was immediately admitted to hospital, where he was tested for the virus. He spent 12 days in hospital, 8 in intensive care. He suffered a series of complications, and on September the 15th, his clinical profile began to deteriorate significantly. On September the 18th, he suffered cardiorespiratory arrest, from which he could not be revived. We offer our condolences to the family and friends of the deceased. The other patient was a 49-year-old man from the municipality of Antilla in the province of Holguín. He suffered from pre-existing health conditions and was transferred to a hospital in Banes. The virus progressed quickly with many complications, which resulted in the patient suffering cardiorespiratory arrest, from which it was not possible to revive him. Again, we offer our condolences to his family and friends. We reiterate that COVID-19 is an illness with many associated complications, and despite all the efforts of our healthcare professionals, timely treatment and screening, this virus can lead to a range of complications, which is why we want the population to be aware of just how significant it is. Unlike what some people have been claiming, it is not simply a common cold. Today, 2,001 people are hospitalized in Cuba. 95 are under observation. There are 1,250 suspected cases and 656 confirmed active cases. Yesterday, we processed 7,554 samples in our various molecular biology laboratories. 2,199 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 903 in Havana's Hygiene, Epidemiology and Microbiology Center, 814 in Villa Clares, 285 in Santiago de Cubas, 470 in the Genetic Engineering and Biotechnology Center Lab, 460 in the Hermanos Almahedas Hospital, 415 in the Molecular Immunology Center, 415 in the Manuel Fajardo Hospital, 361 in the Naval Hospital, 358 in the Civil Defense Laboratories, 322 in the Fructuoso Rodriguez Hospital, 351 in the ICA Laboratories, and 201 in the National Center for Genetics. Of the 7,554 samples processed, 51 tested positive for COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 531,928, of which 5,055, or 0.95%, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested: 53 from Pinar del Rio, 101 from Artemisa, Havana with the highest number, 5,448, Mayabeque, 338, Matanzas, 216, Villa Clara, 101, Sancti Spiritus, 114, Ciego de Ávila, 250, Camagüey, 334, Las Tunas, 113, Holguín, 216, and so on and so forth from all of the country's territories. Of the 51 positive cases diagnosed yesterday, 48 are Cubans and 3 are foreign residents in the country. I repeat, these 3 cases linked to foreigners are not imported cases. 45 or 88.2% of the 51 positive cases yesterday are confirmed case contacts. This means that 4,560 people, or 90.2% of all diagnosed cases in Cuba, had contact with someone who had previously tested positive for the virus, making this the group at highest risk of infection. Of the 51 cases diagnosed yesterday, the source of infection linked to 6 is yet to be determined. The source of infection in 56 cases, therefore, reported over the last 15 days, is still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 439. Of the 51 diagnosed cases yesterday, 34 are male for 50.2% of all cases, and 17 are female, representing 49.8% of all diagnosed cases on the island. 37 or 72.5% of the 51 cases yesterday were asymptomatic at the time of testing. Overall, 59.4% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 63% of cases over the last 15 days. By age group, 7 positive cases diagnosed yesterday are under the age of 20, 5 of which are under 18, for a total of 536 children or pediatric cases to have tested positive for the virus in the country. Of these, 454, or 84.7%, have recovered from the virus and been discharged from hospital. Meanwhile, 25 people to have tested positive for the virus yesterday are between 20 and 39 years of age. 16 cases are between 40 and 59, and 3 are over the age of 60. Of the 51 cases diagnosed yesterday, 33 belong to Havana, 14 to Matanzas, 2 to Mayabeque, and 1 case each to Artemisa and Holguín. Of the 51 autochthonous cases, the one from Artemisa belongs to the municipality of San Cristobal. The two from Mayabeque are all from the municipality of San Jose de las Lajas. The 14 cases from Matanzas belong to the municipality of Cárdenas. The case in Holguín is from the municipality of Antilla, and the 33 cases from Havana belong to the municipalities of Arroyo Naranjo with 8, Habana Vieja and Regla with 4 each, Playa 3, Cerro 2, 10 de Octubre with 2, La Lisa, Boyeros, Centro Habana and Habana del Este, all with 2 cases each, and Plaza de la Revolución and San Miguel with 1 case each. Yesterday's results therefore mean that Ciego de Ávila continues to be the province with the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 57.89. Havana follows with a rate of 18.13, slightly higher than yesterday. Artemisa's rate stands at 7.91, then Sancti Spiritus with 6.22. Matanzas' rate rises to 5.42, as does Mayabeque's with 3.38. Camagüey has a rate of 0.78. Pinar de Rios stands at 0.69, then Cienfuegos with 0.49, and Holguín with a rate of 0.29. Meanwhile, Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have reported no new cases in the last 15 days. This means that Cuba's rate rises slightly as compared with yesterday to 6.90 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,055 people who have been diagnosed with the virus thus far in Cuba, 656, or 13%, are active hospitalized cases. 638 of these 656 are clinically stable. Yesterday, 2 patients died as a result of the virus, meaning that the COVID-19 death toll on the island now stands at 113. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 35 people were discharged from hospital, 29 in Havana, 5 in Ciego de Ávila, and 1 in Sancti Spiritus. This means that to date, 4,284 people, or 85% of all confirmed cases in Cuba, have recovered from the virus. Today, 5 patients being treated in Havana and Camagüey continue to be in a critical state. 13 patients in hospitals in Havana, Camagüey, Villa Clara, and Matanzas are also reported as serious. Yesterday, 1 new patient joined the group of those reported as critical, 2 joined those reported as serious, while 3 serious patients passed to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 312,009 people were diagnosed with the virus, for a total of 30,214,496 confirmed cases since the start of the pandemic. Yesterday, 5,374 people died of the virus, for a total of 946,665 COVID-19 fatalities and a mortality rate of 3.13%. The region of the Americas, which accounts for 50.85% of all cases worldwide, reported 117,973 new cases yesterday, for a total of 15,363,225 people to have been diagnosed with the virus. Meanwhile, 2,748 people died of the virus in the region yesterday, for a death toll in the Americas of 525,168 and a mortality rate of 3.42%. The United States continues to top the list of countries worst affected by the pandemic, with 6,674,458 confirmed cases and 197,633 COVID-19 fatalities. India has over 5 million cases, then Brazil with almost 4.5 million confirmed cases, then Russia with over 1 million. From the Americas, after the United States and Brazil, comes Peru, Colombia, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, the Dominican Republic, and Panama, while Cuba occupies 20th place in the region with a mortality rate of 2.24%. This is the information that we have on the behavior of the pandemic in Cuba and the world.